Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the complications of duodenal ulcers? So, if you see the complications of duodenal ulcers, a patient with duodenal ulcers, the most common complication with the patient with duodenal ulcers is the bleeding. Bleeding or hemorrhage is the most common complication in a patient with duodenal ulcers. Where is this bleeding seen? It is more commonly seen on the posterior wall of the duodenum. You see the bleeding is seen on the posterior wall of duodenum, and it is due to the artery. The source of bleeding is from the artery which is called as gastroduodenal artery, is the most common source of bleeding. So, source of bleeding in duodenal ulcer is due to gastroduodenal artery is responsible for bleeding in the duodenal ulcer. Perforation will also occur, but if perforation occurs, it mainly occurs on the anterior wall. Bleeding occurs mainly in the posterior wall, whereas perforation occurs in the anterior wall. And that doesn't mean that perforation never occurs in posterior wall. Perforation can occur in posterior wall also, but it is more on anterior wall. If it perforates onto the posterior wall, then here you will see pancreas. So the perforation, whenever there is perforation in the posterior wall, the contents go into the pancreas. Okay, next there can be one more thing. Because of this ulcer, the patient might develop pyloric stenosis, though it is least common, but pyloric stenosis can occur because of this, resulting in, though it is least common, the pyloric stenosis can occur, and this pyloric stenosis will cause gastric obstruction, or gastric outlet obstruction can occur in the duodenal ulcer due to pyloric stenosis. Then actually these duodenal ulcers are benign ulcers. There is no malignant transformation of the duodenal ulcers. There is no malignant transformation of duodenal ulcers.
thank you and thank you for watching.